Let me tell you about a man named Terry Parker. Terry had severe epilepsy. We are talking hundreds of seizures that surgery could not fix, that a cabinet full of prescription drugs could not fix. But one thing did help him: cannabis. There was just one problem. It was 1996, and in Canada, that made Terry Parker a criminal. Police raided his home twice. They took his plants, they charged him, and Terry did something remarkable. He did not apologize. He went to the court and said, "This law is forcing me to choose between my liberty and my health, and that's unconstitutional." Hold on to that thought, because that one man's seizures ended up by rewriting the drug laws of an entire country. To understand how big this was, you have to understand where Canada started. Cannabis had been prohibited in Canada since 1923, and here's the strange part: almost nobody knows why. It was added to a schedule of banned drugs with essentially no parliamentary debate, no hearings, no evidence presented. One line in a bill and it was done. For 75 years, that quiet little line sent tens of thousands of Canadians into the criminal justice system. And patients with cancer, HIV, multiple sclerosis, epilepsy, people whose doctors quietly knew cannabis helped them. They had exactly two options: suffer or break the law. Now, here's the twist most people miss. Medical cannabis in Canada was not legalized by politicians being brave, it was legalized because judges forced their hand. The key is Section 7 of the Canadian Charter of Rights and Freedoms: the right to life, liberty, and security of the person. Terry Parker's lawyer argued that a blanket cannabis ban with no medical exception violated exactly that. In 2000, the Ontario Court of Appeal agreed. In R.V. Parker, the court ruled that prohibiting cannabis without a workable medicine exemption was unconstitutional, and then it did something dramatic. It gave the federal government an ultimatum: fix this law within 1 year or it becomes void. Imagine being the health minister that morning. A court has just started a 12-month countdown clock on your national drug law. So, in July 2001, with the deadline breathing down its neck, Canada introduced the Marijuana Medical Access Regulations, the MMAR. And with that, Canada became one of the very first countries on earth with a formal national regulated medical cannabis access program. Patients with a physician's support could get a license to possess cannabis. They could grow their own, designate someone to grow it for them, or buy it from the government. And this is where the story gets wonderfully absurdly Canadian. Where did the government grow its official medical cannabis? In a decommissioned copper mine underground in Flin Flon, Manitoba, hundreds of meters below the frozen prairie, under artificial lights. Health Canada's contractor grew the nation's medicine partially because the mine was secure, climate stable, and very hard to rob. Patients, it must be said, complained constantly about the quality, but the principle was historic. The state itself was now supplying cannabis as a medicine. Now, don't picture this as a smooth ride. The next 15 years were a running argument between patients, courts, and government, and the courts kept winning on behalf of patients. The system was clunky. Doctors were nervous to sign forms. Supply was limited, so patients sued. And in case after case, like Hitzig in 2003, courts kept knocking pieces off the regulations, saying not good enough, access has has to be real, not theoretical. So in 2013, the government tried a complete redesign. The MMPR outwent home growing in came licensed commercial products inspector, standardized pharmaceutical style facilities shipping product directly to patients. This, by the way, is the moment the modern regulated cannabis industry was born. Those licensed producers become the seed of what is now a global sector. But patients pushed back again. Many could not afford commercial prices, and in 2016, in Allard, Canada, a federal government ruled that striking patients of the right to grow their own medicine violated the charter again. So the government rewrote the rules again, the ACMPR of 2016, which kept the licensed producers but restored personal and designated cultivation. Do you see the pattern? Every single major step 2000, 2001, 2003, 2016 was patience and court dragging the system forward. This was not policy leadership, this was constitutional gravity. Then came the finale. In October 2018, the Cannabis Act came into force and Canada became the first G7 nation and only the second country in the world after Uruguay to legalize the cannabis for adult recreational use nationwide. Here's the detail that matters for anyone in medicine. The medical system did not disappear into the recreational one. The Cannabis Act preserved a distinct medical access stream. Healthcare practitioner authorization, registered patients, medical sales channel, personal medical cultivation. Canada deliberately kept a clinical pathway alongside the consumer market, and that dual structure still shapes how regulators around the world, including in Europe, think about cannabis policy today. So when people ask how did Canada legalize medical cannabis, the honest answer is one patient at a time, one courtroom at a time. It started with a man having seizures in Toronto who refused to accept that his medicine made him a criminal. It ran through a copper mine in Manitoba, three generations of regulations, and a string of judges who kept repeating one idea: a person's access to their medicine is a matter of their fundamental rights. Terry Parker never set out to build an industry, he just wanted to stop his seizures without going to jail, but his case created the legal foundation that everything since the licensed producer, the pharmaceutical grade supply chain, the international medical market is built on. The lesson: big regulatory change really starts in a boardroom or a parliament. It usually starts with one patient who says this is not right. Thank you.